Dr. Jain, Saumya Jain from Uttar Pradesh. Today we will be talking a very interesting topic, that is hypertension and the recent guidelines on its management. Hypertension is becoming the major cause of morbidity and mortality in the patients. So today we'll be discussing few points on the recent guidelines and update on the management of hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable disease, of which 27% are attributed to cardiovascular disease, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. The data says in India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29 to 28% respectively. Despite that, nearly half of the people, or 50% of men and 41% of women with hypertension, were unaware of the condition. International Society of Hypertension has released the ISS 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource-poor settings, optimal care refers to evidence-based standard of care, and whereas essential standard refer to minimum standard of care to allow specification of essential treatment. The HA has released a scientific statement in 2021 offering new guidance for the management of stage 1 hypertension among patients with, I again repeat, for stage 1 hypertension among patients with low atherosclerotic cardiovascular diseases, among low-risk adults with no AS-CVD or 10-year CVD risk is less than 10%, with stage 1 hypertension, i.e. blood pressure between 130 to 139 and 80 to 89. Management starts with non-pharmacological therapy like routine exercise, consumption of green fruits, leafy vegetables. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. ARDS, also known as acute respiratory distress syndrome, is potentially fatal condition involving lung damage, and a recent study found appears in JAMA that metoprolol, selective beta-1 blocker, can reduce lung inflammation and improve respiratory function with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 mm of Hg range substantially reduced CV events in the STEP randomized trial, affirming the sprint findings for an older. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office BP measurement, but also on out-of-office measurement, such as ambulatory BP measurements or home blood pressure monitoring system. 24-hour and nighttime BP measurements were associated with greater risk of mortality and morbidity and a composite of CV outcome. Thus, they may be considered as the most relevant measurements for estimating CV risk. For every 20 or 10 mmHg increment of BP measured at night, the risk of mortality was increased by 23% and risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, 2018 European guidelines also recommend, especially in the context of lower BP target, to start antihypertensive therapy with an initial dual dose combination of ACE inhibitor or ARB plus a calcium channel blocker or diuretic. I again repeat, to start with initial dual fixed combination of ACE, ARB with a calcium channel blocker or a diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of an NDMA carcinogen, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by WHO International Agency for Research on Cancer, to be carcinogenic in humans. The HYGEA study also represents the largest study that tested nighttime antihypertensive treatment and its role in the control of nighttime hypertension. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included a total of 20,000 hypertensive patients during an average of follow-up years of 6.3 years. 1,752 participants experienced the primary CV outcome. Ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The relative risk reduction for CV was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.